1. Good morning. I'm Jack Daly, and it's time now for Business Spotlight, brought to you by Morris Hospital and Healthcare Centers. My guest this morning is board-certified cardiologist Dr. Athar Saeed. Good morning, doctor. How are you?
Good. How are you?
I'm great. Well, Dr. Saeed is new to the Morris area, and he is part of the Morris Hospital cardiovascular specialists. So welcome, the first time on the radio. Nice to have you here.
Thank you. It's nice to be here.
Well, it's the first of the year, and time to get serious about getting healthy if you're not already healthy. And obviously, cardio is a very important life element. Can't live very long if you don't have a good heart. So let's talk about risk factors for heart disease. What are some of the common risk factors that you see?
Well, I like to divide, especially when I'm trying to, explain to patients how, what to worry about when it comes to their heart. I like to divide risk factors into two groups. The group you can control and the group of things that you can't control. So things that you can't control include things like age, being a male, and family history. So these things increase your risk, but there's nothing you can do about them. On the other hand, there are certain aspects that we can affect, such as people who are smokers. Not only the fact that you smoke, but how much you're smoking, high blood pressure, diabetes, and then on top of that, there's also things like diet and how much we're exercising and weight that also play a role. Other conditions can sometimes also affect your heart, such as autoimmune diseases, but for the most part, the things that we discussed earlier.
Well, here we are, the first of the year, and it's always a good time. People like to lose weight. They like to get a little more maybe exercise, pay more attention, maybe quit smoking. Mm-hmm. Smoking is a big risk factor. So it's important to know, as you mentioned, what some of those factors are. So if you maybe are overweight, you smoke, what can someone do? What would be a good course of action?
Well, I mean, it's exactly like you said. A lot of the things that are on that list are things that are also on people's New Year resolutions. Exercise. Exercise is very important. Not only does it help you lose weight, but it also helps your heart stay strong and keep the blood flowing, obviously. So it's always good to start a good exercise regimen. Older patients, I would always recommend that they discuss with their physician whether or not they're obviously healthy enough to exercise. But for most patients, most people actually are. The benefit for exercising is not only do you prevent progression of heart disease if it's already there, but on top of that, if you do have underlying heart disease that's unknown, if you exercise, you're more likely to realize things are progressing. If you were able to run a mile and now you can only run half a mile before you get short of breath, it should serve as a trigger to alert you that there's something up. Things like smoking are also important, like you said. If you can't cut down, if you can't stop altogether, it's important to cut down. There are also things that, again, your physician could give you to kind of assist in smoking. Smoking is difficult to quit, but it's important that people keep trying.
Let me ask you this. Do you need a referral from your family physician to make an appointment to see you for a checkup? Or can they just call your office directly and make an appointment?
No, they can just call and make an appointment directly with us. Then we can see, and again, if they need any help or counseling or anything like that in reference to minimizing the risk factors, managing their hypertension, things like that, that's something that we could see them for. You don't necessarily have to wait till you have a heart attack to see a cardiologist. Cardiologists are able to manage high blood pressure. They're able to also help with tobacco abuse. But if you have a primary care provider, there's no harm in asking them as well if they wouldn't mind sending. But it's not necessary.
Doctor, thank you very much for joining us this morning as we kick off the new year with some good information about taking care of your heart. My guest this morning has been Dr. Athar Saeed, Morris Hospital cardiovascular specialist. Doctor is a board-certified cardiologist. Doctor, thank you for being with us this morning.
No, thank you for having me.
There are office locations in a number of different areas where the cardiologist can be seen. It's in Morris, obviously at the hospital. The Ridge Road campus in Channahon, also in Dwight and in Ottawa. And a general number that you could call the hospital to get more information would be 815-705-1000. You've been listening to Business Spotlight, brought to you each Friday morning at the same time by Morris Hospital and Healthcare Centers. I'm Jack Daly. Have a heart-healthy day.